So yeah, this is kind of embarrassing to show, but a close-up of my hand, because I do want to point out it's dry.
Oh,
I'm
yes.
feeling it. Yeah, my hands are so wrinkly. I feel like they've aged a lot, even just this morning sitting out here. But we're talking about dry winter weather, what it does to your skin. And so we do have the expert here with us. Dr. Palm, thank you for joining us.
Thank you for having me,
With
Nana.
Art of Skin MD in Solana Beach area.
Yes, right up the road.
Yes, right up the road. And you're a very popular office, by the way. I know a lot of friends who really appreciate your work and your services.
I'm glad to hear that.
But winter weather, of course, we're feeling it. It's cold, but it's dry, and I mean, do the weather, and it's like dew points are down in the single digits sometimes. So it really does show.
Yeah,
what do we do?
and it's brutal right now. And I'm in a coat. You're in a sleeveless, which you're super brave. But we'll talk about ways to really like secure hydration and lock it in, because just like you're seeing, we're getting something called transepidermal water loss, which means like all the water is escaping from the surface of the skin. So how do we change our routine? I have to wash my hands 60 to 80 times a day in clinic.
Being a doctor, yeah.
I know. So what do you do? So one of the products I've found, actually using some of these alcohol washes, they dehydrate the hands less than soap, believe it or not.
So but this is instead of soap.
Yeah, and there's some formulations that are actually more hydrating. This is one that I found that I love. It's a little harder to find, but after you wash your hands, washing hands isn't bad, but you need to lock it in. So I brought some of my favorite products. You want to look for things that have ceramides, which are cholesterol-derived fats that actually help moisturize and lock in the moisture to the skin. And at night,
ceramide. So remember that word.
So like we read and Cetaphil, both of those product lines have ceramides.
Okay, so like we read food labels, but why don't we read lotion labels?
Yeah,
right?
so look at the ingredients. Just flip it over. Other things to look for: free fatty acids. Those help sort of incorporate into the skin's surface. And then a hydrating agent, hyaluronic acid, is one of them. But also look for squalene and squalane. Those are sort of cholesterol derived. They again lock in the moisture. I have patients with either contact dermatitis, bad eczema. I myself have been doing this during the winter. You can get cotton gloves off of your favorite ordering site that delivers the next day. And this locks in moisture at night. So put on your moisturizer first, then use that. But
so you can put on any of those types of lotions and then wear the gloves.
Yeah.
It may look funny, but it protects your pillow sheets too, doesn't it?
Yeah, no, absolutely it does. And I know it's a little silly to do, but having that little extra barrier, it really drives some of the hydration into the skin. And then exfoliation. You notice that you're getting dry scale, so we need to...
I could scratch this letter. I tried to make the letter N in here, but
so way to wear that off is something called gommages. So gommages are gels that you put it on the skin. They're very gentle, and they lock on to keratin and lift it off very gently. You can also use a cleanser that's got lactic acid or glycolic acid, and then finish that off with a hydrator. So I tell patients, when you're traveling, consider one of these aerosolized mineral-based sprays.
Is that just water?
Yeah, they've got water, but there's a mineral composition that actually helps restore some of the good bacteria to our hands, which are really critically important, especially in eczema patients. And then consider doing a mask. So this is a line I like, but there's lots of hydrating masks out there. Put it on. Sometimes you don't even have to wash it off. You can just kind of work it down onto the neck.
And then what is this one? I like this device.
So that's the newest. Yeah, Clarisonic brushes are very popular. And this is one of the newest technologies. There's all sorts of brush heads that can be used for body, for face, for hands, if you need a little bit of exfoliation.
Why not brush your hands?
And I think during the wintertime, you want to use a more sensitive brush rather than something that's a little bit sturdier. And then thinking about from the inside out, so stay hydrated with some water. Consider even green tea, which has got polyphenols. They're great antioxidants that also guard a little bit against UVA, visible light, infrared light damage, because even though it's cold here, it's still sunny in San Diego.
Yeah, and I mean, we still feel thirsty, and of course you don't want to feel thirsty. Your skin gets it too.
Yeah, and things at home, you can do a humidifier in your room if you're really struggling, and just make sure you're reapplying. So one application isn't going to be enough to get through the day.
So these are doctor-approved lotions, I think.
Yes, and ask your derm if you're traveling. We often have these cute little travel size, and instead of you having to go to the $1 aisle or $3 aisle at CVS or Walgreens, we can give you a little sample to try some of those first.
I'm just helping myself.
I know,
I'm desperate. My hands literally hurt because it's so dry. Thank you very much for your expertise.
My pleasure.
And of course, we can get more information at
artofskinmd.com.
Perfect, Dr. Palm. Thank you. Eric, we'll send it back to you now.
Dr. Palm knows it all, doesn't she? You're right. You put on that lotion and it just evaporates. You got to just keep lathering it on. I feel like I've got like alligator skin right now.
I'll bring you a little bit too.
Yeah, all right. Sounds good. Thanks, ladies.